Over 56 million people in the U.S. have received at least one dose of the COVID-19 vaccine, but millions more need to be administered in order for the nation to achieve herd immunity. David Begnaud visited one California hospital where employees have already reached that threshold.
So a lot has changed. UC Davis has gone from just vaccinating employees to opening up spaces like this to vaccinate their patients. But here's why we came back for a follow-up. They called us a few weeks ago and said, listen, we have achieved herd immunity within the health system, and it's having huge implications, even financial implications, that are benefiting us. So I said, okay, tell us more. And they said, well, when you were here on day one of the vaccine rollout, we had 210 employees out sick with COVID. Do you know how many they had as of yesterday? Only 10. 93% of employees within the health system said, I'll step up and get vaccinated. But what's interesting here is that they had some who said, you know what, I don't want it, and then decided to get it. Watch. Meet Chastity Whitmer. She's a nurse. She was delivering babies at the height of the pandemic. And when her time came to be vaccinated, she hesitated.
What were some of your initial concerns?
If I got the vaccine, would I get COVID? What would my side effects be? How long would it last?
Good girl.
But with a husband who stays home and takes care of the kids, this is what changed her mind.
I was orienting a relief charge nurse on my unit, and we were kind of having a discussion. What happens if we got COVID? We wouldn't be able to work, we wouldn't have income, we wouldn't have health insurance, and so we kind of just talked amongst each other and boosted our confidence up and stood in line to get vaccinated.
She and more than 90% of the staff here at UC Davis Medical Center in Sacramento, California, have received at least one dose of the vaccine. Now listen to how high the rate is at the emergency department.
So we have 100% compliance amongst emergency physicians.
100%?
100% amongst the emergency faculty.
This is Dr. Nathan Cooperman. He is in charge of UC Davis's emergency department. We were there back in December when he got his first shot. How has vaccinating the vast majority of employees here changed your ability to staff the ER?
That is a great question. So before the vaccine came out, on any given day, we would have between 100 and 150 employees that were sick with COVID and were calling in sick and were not coming in.
And now?
Now, I think it's single digits. I mean, there's less than 10. Suddenly, there was like this pressure lifted from our shoulders.
It's not just UC Davis's health system. Across the University of California health system, cases among health staff dropped from 431 per week to 171 per week. And with fewer staff out sick, the strain on healthcare workers has really dropped too. Ann Tompkins, the interim employee health services director at UC Davis Medical Center, showed us the data.
It's working. The numbers are a testament. People's stories are a testament that the vaccine is truly working. And we're going to be okay. Back to Nurse Whitmer for a moment. She's gone from being a vaccine skeptic to an evangelizer, and here's why. A few days after she received her second dose, her husband, her mother, her 3 kids, and her grandmother all tested positive for COVID. You know who didn't? She and her grandfather, and they are the only 2 in the family who have been vaccinated.
My husband was extremely sick with COVID pneumonia, was here at the emergency department for 9 hours. My grandmother spent 25 days in the hospital with COVID pneumonia and is still recovering on oxygen. It's not fun seeing your family members sick. It's very scary. Being a nurse, watching them get sicker and sicker, and whether to go to the hospital, whether to stay home.
What do I hear in your voice? I hear the breakup.
Yeah, just reliving it.
And when you relive it, what makes you emotional?
Not knowing if my husband would be one of the ones that would live or die.
What a story. She went from saying, I don't want it, to thank God I got it. One of the health officials here at UC Davis said, listen, COVID-19 is no longer an occupational hazard within our health system. Think about that for a minute. No longer an occupational hazard. Now, one thing they continue to do, masks, social distancing, temperature checks. Even though they've reached the herd immunity, they're still practicing that. Vlad and Marie, back to you.
David, thank you very much. It's a great story that David just told, Anne-Marie, and I'm glad he found somebody who can sort of highlight some of the contradictions and the contrast that people sometimes feel with everything related to the coronavirus. I just wish that people didn't have to get to the situation to the point where their family members are sick and struggling to breathe and on oxygen before they realize what we've been told pretty much since the beginning of the pandemic, the steps that we've been told to take to prevent ourselves, to prevent our loved ones from getting sick. And even now, the thing that we talked about with Dr. Hess and others earlier this week, that people think once they've been vaccinated that, well, that means everything's okay. You still have to wear a mask, even after you've been vaccinated, because you could still spread it to other people, even though you don't yourself get sick.
Right.
Yeah. All right.
Yeah, it's true.
So let's talk about this. President Biden's trip to a Pfizer vaccine facility has been postponed because of the weather. It's a winter snowstorm hitting the nation's capital. The snow and the ice have blanketed much of the U.S. already, disrupting vaccine distribution across the country. And now the CDC is warning that it expects the severe weather to continue to cause widespread delays in vaccine shipments over the next few days. So for more on this, let's bring in Dr. Susannah Hills. She's a pediatric airway surgeon and assistant professor of ENT at York-Presbyterian, Columbia University. So, doctor, how big of a setback is this?
Just when we thought this vaccine rollout couldn't get any worse, right? Here we are dealing with this weather disaster, and it is really affecting the whole country. Here in New York, we're not dealing with the same weather disaster, and yet we're still set back by 35,000 doses of vaccine. I'm right across from our Armory Center, which serves the entire surrounding community with vaccines. And we are closed for new appointments for first doses because we only have enough doses right now to give second doses. So it's a huge setback for the whole country. But, hopefully this isn't going to be setting us back more than a week or two.
So the U.S. is apparently vaccinating an average of 1.7 million Americans per day, which is up from 1 million a day just a month ago, which I suppose is very good. The president wanted to be delivering 100 million shots in his first 100 days. And, some people said, oh, that's actually not overly ambitious. That's probably doable. But I see now with the storm that you sort of have to prepare for any possible hiccups along the way. But are you heartened by the fact that we seem to be increasing the pace?
Yes, of course. The trend has been increasing week to week, although slowly. We're still not at 2 million doses a day. But we've got some lights at the end of the tunnel. Hopefully the Johnson & Johnson vaccine is going to be approved in the next week or two. That will hugely increase our vaccine supply, hopefully within the coming months. We have new FEMA centers that are opening up. California just opened 2 centers. There'll be centers opening hopefully next week in Texas, which has been really hard hit by this weather disaster. So that's another light at the end of the tunnel. And the pharmacies around the country are going to be able to distribute doses too as soon as we get past this hiccup, this bump in the road with weather, and get the distribution or dissemination of vaccines underway the way it should be. But yes, it is definitely the vaccine distribution process has been ramping upward, and I think we're going to see it take an even steeper increase with these different events that are coming ahead that are going to increase distribution.
So let's talk about our troops, Doctor. Defense officials at the Pentagon say only 2/3 of our troops have been offered the vaccine. Those that have been offered it have taken it. And a survey by the military family nonprofit Blue Star Families reveals skepticism about the vaccine within the community. We just saw a piece where somebody who was actually on the front lines also expressed some skepticism before realizing that, in fact, it was a real thing. The virus was real, and the vaccine was also able to prevent you from being infected. So what are you hearing may be leading to this skepticism, specifically as it comes to the military?
Yeah, it is always surprising to me, but it shouldn't be. The concerns people have are really valid. And even in hospital systems across the country, here in New York even, our own staff within hospital systems, there's a significant rate of vaccine hesitancy. So it's not just the military, it's everywhere. And I think it absolutely speaks to the fact that we need to do better with communication and with education. Because what we're finding is when we reach out to the communities that are having hesitation, be it the military, here in the hospitals, in local communities that are hesitant to get vaccines, when they're getting good information from a trusted source, it's not that people don't want the vaccine. They do eventually when they get good information for the most part. It's just that they're not getting the kind of information that they need. So we need to do better with education. We need to do better with communication. In terms of the military specifically, I cannot speak to how invaluable they have been in helping us manage this pandemic. Here in New York in the spring, we had hundreds of military veterans here helping in our field hospitals. And I worked with 5 Special Operations Forces veterans managing our COVID patients who had tracheostomies. They were absolutely invaluable. They deserve to be protected. They deserve to get the information that they need to make a good decision. So hoping that more and more of our military do get vaccines and do get the protection they deserve.
So the CDC says life expectancy in the U.S. actually fell a full year to 77.8 years as this pandemic took hold of the first half of 2020. So I kind of have 2 questions. One is not for you, doctor. One is for the people out there who say that the death rates associated with COVID are exaggerated. How do you explain this CDC finding about life expectancy? The question for you, doctor, has to do with when you drill down and look at the numbers, when you break them up along racial lines, you see something that we have been talking about all along, that minorities are being hit particularly hard by this pandemic.
By almost 2 years. In other words, the number is for non-African Americans, it's about 1 year that the life expectancy has declined. But for Black Americans, it's 2, which is significant.
Yes. And, this is absolutely a reflection of what we've been seeing this entire time with the inequities in our healthcare system and with the social determinants of health. When you look at the number of deaths due to COVID, I mean, there's a 6 times higher rate of deaths among our Black and Latino population. And yet, when you look at our vaccine distribution right now and how we're addressing these inequities, only 5% of our Black population are getting vaccinated and 11% of our Latino population are getting vaccinated. So we're seeing incredibly higher rates of death and illness in these communities, and yet they're not getting vaccinated nearly at the rate that they should be. And so it just reinforces that we've got to be reaching out to communities with access to vaccines. We've got to be prioritizing these communities. We've got to be not only providing the vaccines, the doses, and the support, but we've got to be providing education, communication, outreach at a community level so people get good information, too, from people they trust, like I said before, about why vaccination is important. But we've got to do better for these communities. They've been hit the hardest, and yet right now they're being served the least with vaccination. This data about the life expectancy comes from the first 6 months of the pandemic from last year. So I'd like to see, when we recheck this information about life expectancy, how are we doing? Are we making any headway in doing the right thing with reallocating resources appropriately?
That's actually really, really fascinating, doctor, because, the first 6 months, arguably, we were still trying to understand the virus, how it was spread. There was a lot of, there wasn't a lot of common ground when it came to how to handle it. In 6 months, we learned a lot. I don't know if our behavior changed it a lot, and it would be really, really telling when we see sort of what the last half of 2020 looks like. Hopefully there's something to look forward to. Dr. Susannah Hills, thank you very much.
You bet.